Okay, so you are ready? I'll just start the task.
Yeah, I am ready.
Yeah, okay. So clinical ready. So you'll be given 6 minutes and then 3 minutes for discussion. And we will start now. Your time starts now. Your task is to examine this 11-year-old boy. Examine his 7th to 12th cranial nerves. Your time starts.
बेसिकली वो है फेशियल ऑफ पैल्सी लग रही है उसकी। जो लेफ्ट आई है वो बंद है, जो राइट आई है वो थोड़ी सी खुल रही है, वाइट ऑफ द आई नजर आ रहा है, और एंगल ऑफ द माउथ डिविएटेड है टुवर्ड्स द लेफ्ट। राइट का नेसोलेबियल फोल्ड नहीं है, राइट की आई ऐसे बंद नहीं हो रही, लो मोटर न्यूरॉन लीजन लग रही है राइट साइड की, 7th।
कितना बच्चा है?
नहीं, मुझे लग रहा है 10-12 साल का।
Can you talk in English? The exam is going to be in English. Dr. Vasan?
Well, this is another candidate. It's not me.
Yeah, okay. I just saw some Aisha Khalid.
Yeah, I couldn't even understand. Well,
Yeah, she gave some clues to you in Hindi, I said.
I hope I can understand.
Yeah, you start now. Your time starts now.
Okay. Hello, my name is Wasan, one of the candidates.
Okay.
I believe I'm. Can I just get the name of the mother and the child, please?
The child's name is Abdul.
Abdul, and his mother?
Mother is Khalida.
Hello, Mrs. Hello, Abdul. How are you?
I'm good.
My name is Wasan, one of the doctors here. I'm going just to examine you, if you don't mind.
Yes, doctor.
Hi, Mrs. Khalida. I'm just going to examine Abdul. Is that okay?
Yes, doctor.
Okay. I'm just going to ask you, Khalid, if you don't mind. Do you have any pain anywhere?
No, doctor.
Okay. I'm just going to check his mentality, and also I can see he has an abnormal facial features. I'm going to check his facial nerve by inspection. There is an asymmetry, and there is a mouse deviation to the left side. And I'm just going to ask, can you show me the smile, Abdul?
He just shows you the smile, and that's there depicted in the picture.
Okay, can you lift up your eyebrows if he is able to do that?
Yeah, he's able to raise the eyebrows.
Okay, can you show me angry if he can cross his eyebrows?
Can you show me that?
So if he can he can close his eyes?
Yeah, that's there in the picture.
Okay, and I'm just going to ask if he can show me his teeth. I can see there's a deviation as well. He's below his cheeks.
He's trying to blow his cheeks, and you can just push it over one side.
Okay, is he able to whistle?
He's not able to whistle.
Okay. Also, I need to check his sensation. So showing him a piece of cotton, and I'll checking his forehead and his maxilla and in his lower jaw. That will be checking his trigeminal, and I need to check other cranial nerves. Also the optic, ophthalmic, and also I need to check his. You said the 12. I'm just going to ask him for the 12 if he's able to shrunk his shoulders.
Okay.
Is he able to do that?
Which one?
His shoulders, can lift up his shoulders.
Yeah, he can do that.
Okay, stick out his tongue.
Yeah, he can stick out the tongue.
Any abnormal fasciculation, any movement in his tongue?
I didn't get you.
Any fasciculation in the tongue?
No, no,
Any wasting?
no.
Okay. Also, I need to check his vestibulocochlear. Is he able? So he's able to hear me. So his hearing is intact. Also, if I'll check his eye movement, is he able to move the sides? You know, the H shape. I need to do the optic visual field, visual acuity. Also, I need to check his back, and I need to do upper and lower motor neuron, upper and lower limbs for power tone reflexes. And I also need to check his gait, anthropometric measures for weight and height, and plot them in the centiles. Is there any abnormality in his gait?
No, no abnormal.
Okay, and upper limbs and lower limbs, power tone reflexes, sensation, coordination.
That's all normal.
Okay, and his back is intact.
Yes, you have one more minute.
Sorry?
You have one more minute.
Yes, so I also need to check his blood pressure, vital signs, and also his skin, if there is any rash. And so can I present my case, or because I feel I've finished?
Yeah, you're finished. Okay, so you have 20 seconds.
Yes.
We'll wait for 20 seconds and then we'll start.
Okay.
Okay, so you can just present your case, doctor.
So I had the pleasure to meet Abdu. He's 11 years old boy, presented with his mother. He has an abnormal facial features in a form of unable to close his eye, with the mouth deviation to the left side, with upper and he's able to move his eyebrows. Putting my finding together, this is a case of upper motor neuron lesion with a facial palsy. Putting on top of my differential will be a brain infection, brain tumor, or post trauma.
Hello?
I think that's.
What is going to be your line of management?
I need to take
Cause
yes.
here. What do you think is the commonest cause here?
I need the commonest cause
Yes.
for upper motor neuron facial palsy could be a brain infection, post brain infection, post tumor, CNS tumor, and post trauma.
Okay. Why do you say this is an upper motor?
Because I think I put it in my my differential, it's a lower motor, but because you said he's able to lift up his eyebrows,
Okay.
so upper is not spared.
Did you see which side you was able to lift his eyebrows?
Which side?
Yeah. Did you ask which side he was able to lift his eyebrows?
No, I didn't ask. Yeah.
We'll come to that later. Okay. So
Mm,
this is the Bell's palsy.
okay.
What is your management?
My management, I need to do a full examination, a full history. I also need to do a full examination, neurological exam. I also need to check his gait, rash. Also, I need to check his hearing and speech. Um, if there's any visual, vestibular involvement.
Your time is
Also, in nystagmus, I need to involve my senior. Also, I need to involve the neurologist consultant. I
your
need to
time.
run some tests. Sorry. Oh, yeah.
You did well. Okay. So just can you introspect yourself?
I think I was confused. I was shocked with the cranial nerves because I never practiced doing cranial nerves before.
I felt so. If you would have practiced, then I think your friend gave you some hints. So with that, you could have.
No, no, I couldn't hear because I couldn't understand. It wasn't in English.
No, you don't know Hindi.
No.
Suddenly she spurt out all the points in Hindi. Okay. So, that was a good attempt, actually. You introduced yourself, you made the parent and the child a little comfortable, everything is fine. Then you should look at the surroundings. You should ask for the environment. You should see whether there is any devices. Suppose suddenly they can have some eye bandage for this child in the environment. They can have some eye drops. This
Mm,
the Bell's palsy, so they can have some eye bandage or eye drops. These are all real cases. So they will be
yeah.
coming from the ward. They'll be having something from the ward. So that will give you a clue. So you should have been asking about the environment. In this case, if you have not asked for dysmorphism, that is okay. But he is a big child, so you should have asked for his dimensions, whether his height and weight is okay, whether his development is okay. A little bit on that, or you should just mention he seems to be in normal height. He seems to be well built, something a little bit of the general examination, and then you go. But one thing is, you cannot ask any history here. So you should not ask, do you have pain? If it's an MSK, then you can have that question. The only place where you can ask three questions is in MSK. So here,
Mm,
I think you should not have asked that question. Are you in pain? Do you have any pain? I think that will undermark you. So you can tell him that. See, if I'm not going to hurt you, but if you feel pain somewhere, you tell me. I'll stop examining. That is okay for you. Okay.
mm,
You started with the facial nerve palsy. You asked to raise the eyebrows. That is okay, but you didn't ask me which side there was a loss of wrinkles. So that's why I was not very specific. But I think you would have got it if you are with the patient. That you would have. I know you know that what is the difference between an upper motor neuron lesion and a lower motor neuron lesion. So I think you should have done it when you are there with the patient. You ask to puff out, you ask to smile, you ask to whistle, and then you should tell that I will do a sensory of the anterior two-third of the tongue. I will. They may not have the thing that is needed, but you should verbalize that. And then you should go to, this is going to be 7th to 12th now. So what is the 8th now?
the vestibulocochlear.
Yeah, so how do you test for that?
Hearing first, and then I need to
You need to do Sugar and Rennie, which if it is there.
running, yeah.
But how do you test for hearing? This is going to be a fast hearing assessment. How you are going to test the hearing?
I will whistle next to him,
Uh,
or I talking to him, so he is hearing me.
So you go behind him and then you tell him, I'm going to tell you one number in one of your ear. Can you repeat the number? You tell him silently one on one side and then three on other side. See if he is going to repeat. This is all some he is going to repeat. So it's going to be some fast assessment, some kind of show that you know that you're going to tell that. And anything else you want to do for the eighth now?
The eight, then the Drennan and Webber test with
Anybody else?
the fork.
Else?
The others balance, sir, balance.
Huh?
So
Balance, yes, very good. So he's always there. Balance. So you ask him to stand for a moment, and then you can even ask him to close his eyes. So that will different. So you will show the examiner that you know that. That's all. And then you come to the ninth now. How do you test for the ninth now?
Glossopharyngeal, I will ask, I will do the gag reflex is not allowed, no?
Yeah, you ask him to say ah, and then,
Open, yes.
yeah, and then see the uvula, and gag reflex is not allowed. And then how do you test the tenth now?
The
ask the
tense,
patient to talk. So any hoarseness,
Yes. So you
means
ask you ask him, how are you? He will say, I am not okay. So means you check his hoarseness of the voice. And then you have to check for the 11th now. How you are going to look for the 11th now?
if there is any wasting,
No.
any fasciculation.
shrug his shoulders.
That,
He will resist and ask the patient to shrug your shoulders. And then to check the sternocleidomastoid, ask the patient to see one side and he will be resist.
yes,
If
exactly.
he can turn his face
To one side.
and resist, it will, yes.
And then you ask him to stick out the tongue, and you should ask him to move from one side to another side, or you can test him to push the tongue to with your keeping your support of the finger on one side. Try to test the power of the tongue. So I am going to finish with if it is going to be 7th to 12th, I'm going to finish with the taste sensation. I'm going to finish with the gag reflex. I'm going to finish with a proper auditory examination. If it is going to be a 1st to 6th cranial nerve, I'm going to finish with the Snellen's chart. I'm going to finish with the fundus examination. I'm going to finish with the corneal reflex. So that's going to be the 1st and 6th. So you don't ask him to do walk, gait, and all. The examiner will get annoyed if you ask to do a cranial examination and you ask him to do. You are going to check for the motor system, sensory system, or I'm going to do a detailed neurological examination. After this, you can tell BP, blood pressure is fine because he has a palsy. But I don't want you to check for the back, and also he may get little annoyed. The examiner will get little annoyed. I didn't get what the 7th one, upper motor or lower motor. Supposedly it is a Bell's palsy, but since she didn't ask particularly, I just wantedly skipped that. Okay.
Okay.
So I think you did well, but you can practice in this domain, and I want you all to practice the others more, because you'll be more familiar with the CVS. This I feel specifically that this online examination system means this online teaching lacks in one area, especially with this clinical. So I want you to keep seeing the children, normal child, make him sit in the office, and then you ask him to do all this repeatedly, 7, 8, 9, 10, 11, 12, 7, 8, 9, 10, 11, 12. You keep doing that again and again, and try to finish it in 5 minutes or 4 minutes, and then you'll not forget that in the exam. So I'm going to, okay.
Apa dah,
Want to see once again?
Why he is holding this yellow bag?
You want to see once again?
Yeah, again, please. I didn't get the. I can't get it.
Okay.
Yeah, okay.
Thanks, start.
Yeah. Let's start. I can see early childhood boy. He is at home, not home sitting, hospital sittings. He looks well nourished for his age. In spite of, I need to plot him on the growth chart for height and weight. And he doesn't has any dysmorphism. And dysmorphic, he is not connected to any devices. While the caregiver give him instruction to go back and forth, I noticed that he has circumduction gait at the right side with decreased movement on the right side, at same sides. So it's hemiplegic gait, right side hemiplegic gait for differential diagnosis. My top of differential will be maybe hemiplegic gait due to either vascular insult, thrombosis, maybe due to post-trauma, post-tumor surgery, or also tumor, and maybe part of trauma, as I mentioned, and AV malformation, or post-meningitis or brain insult. Okay.
Anything else you are seeing? Anything else you want to tell?
Any things I want to tell? Yes, he is comprehensive. He has limbing. He has a limbing gait.
Others, you have completed only 2 minutes. Others can put it as a direct response to me, not in the.
He is well communicating. Yes, he is alert.
Okay.
And there is no facial asymmetry.
Others can put your diagnosis to me directly.
He has limbing side. I noticed that the right side there is circumduction. I can't get really the gait properly.
Okay. So suppose, Dr. Raja, this is an ataxic gait. What all do you think will be the cause?
Ataxic gait?
Yeah, you assume that this is an ataxic gait. What are complications, what are the causes you expect in such an young child?
Yes, as an ataxic gait may be acute causes and maybe chronic causes. Acute causes may be post-viral cerebellitis, maybe tumor, a posterior fossa tumor, maybe brain stem tumor, and maybe viral, and maybe trauma also, and maybe drug cause for acute ataxia. For chronic attack,
you expect commonly, what drug you expect to cause this?
post-viral cerebralitis, the most common, and the drug.
Drug,
And
what?
trauma, maybe accidental or non-accidental.
Can you name one drug? Common
Drug phenytoin, drug cause phenytoin, of course.
Can you name one common virus, post-viral?
Varicella viral.
Okay. So suppose you assume that this is an older child. This child is at 11 years, and this child
Yeah.
has some reddish eyes. So what do you think the cause will be?
Yes, if the patient has not well nourished and he has recurrent infection, I will put on my top of differential ataxia telangiectasia.
Yeah. What do
Yeah.
you think the child will have other problems if the child has ataxia telangiectasia?
Yes, if older age, I will suppose other than ataxia telangiectasia, Friedreich ataxia, maybe labyrinthitis, maybe.
Ataxia telangiectasia. What do you think the child will have the other problems?
I can't get your question, doctor.
Can you tell other manifestations, clinical manifestations in ataxia?
Yeah, for ataxia telangiectasia, yeah. Dilated veins of the eyes and around nose and the ears, and the patient has a short stature, not failure to thrive, and he has history of recurrent infection, mainly chest infection.
Okay, good.
Yeah, and with ataxia, maybe he will be wheelchair.
Okay. Suppose he has a portacat, ataxia telangiectasia. With last question for you. Ataxia telangiectasia with portacat. What do you think?
Yes. Yes, portacat, either because he has recurrent chest infection for IV antibiotic, and either for a replacement for immunoglobulin IVIG.
Okay.
Yeah, and for sampling, if you require sampling for prevent harm for the baby.
Okay, good. So your time is over, and so what do you think this gait is?
I'm so not happy because I didn't get the case.
Okay. No, the one clue is see, the others are just trying to catch him when he's going to end the see in the end. He's just walking like a person who was drunk.
Yeah.
He's walking like somebody who is drunk.
Okay.
The child who has got a lot of loading dose of phenytoin. So
Yep.
I think to use the discussion part, you did very well. This usually happens if our diagnosis is not correct, the examiner will directly go to the diagnosis and he asks us, so what do you think will be the cause?
Yeah.
That's how he's going to finish it. No problem. Even if we are not going to get the diagnosis and your discussion is okay, then you'll get almost 80% of it.
I will not be penalized, doctor, for this. My marks will be cut down, even.
Yeah, maybe 1 or 2.
Yeah, of course.
That's all. And remember, please go through, if you are going to take the exam in some time, please go through all the recalls. Now the videos are coming, same videos are getting it in the exam again and again. So we are getting the same videos. So go through all the recalls and all the video recalls pages and Telegram pages. If you want, we can share it that also.
Yeah, I try to look at his hands